Vancouver Emergency Medicine Program residency is based out of Vancouver General, which is the quaternary site for all of BC.
It's the referral center for the province, the burn center, it's the spine center. Get tremendous acuity, so it always keeps you sharp. You never know what's going to happen when you come to work.
The main thing that makes every day a nice experience to walk into work is the people that you're working with. And so we have a really dedicated group of staff physicians who are really keen on teaching.
Being adopted by like all of the senior residents was just such an amazing feeling, and they created such a great community that it made it as seamless as possible.
The bootcamp curriculum starts at the beginning of July every year. It's for all of the new residents that are coming into residency. And it's a 3-day course that involves ultrasound, simulation, as well as procedures practice. We also do fun things too, like go out for drinks and food with the residents. So there's a social aspect as well. Overall, I think it's just a really nice and fun way to start residency and a nice chance to refresh on things before the residency year begins.
At Vancouver General Hospital, every staff knows you, and the rest, obviously, of the department also knows you. But when you work with these staff, they get to know who you are, what your learning style is like, what are your strengths and weaknesses, what are your interests, who you are as a person. And you really get to build that relationship, and along that, to have really great learning experience with these people who also care about you as a person.
As the program coordinator for the residency program, I work very closely with the Associate Program Director, Dr. Tina Yakota, as well as the Program Manager. My work involves many resident-related activities, such as scheduling rotations, scheduling sim and oral exams, as well as event coordination.
Far and away, I think the most important thing about our program is the people. And that's both the co-residents that we have that are our own little family, but also our program director, Dr. Yakota, and our administrators and our staff people. Working here, you feel supported, you feel like you have friends and coworkers at the same time. And I think it's a really special place to train.
Myself and another staff, Dr. Kwon, designed the simulation curriculum. We do institute here in the department in the trauma bay every week, as well as kind of the monthly resident sim upstairs.
We have weekly institute sim in the department, which is we have our nurses, we have our RTs, we have nurse educators, we have a regional sim program that supports us, and we do high fidelity in situ sim with off-service residents, on-service residents, and soon-to-be staff.
An ACE is an area of concentrated expertise, and this is almost like a mini fellowship that's been built into the R5 program in emergency medicine in Canada. There really is an option for everyone, whether you want to pick from a pre-established program or create your own adventure. People have done incredibly cool things over the last couple of years, including doing wilderness and flight medicine out in New Zealand, flying around in helicopters for 6 months. People have done aviation and space medicine and trained with NASA. And then more emerge-focused things like critical care, toxicology, and simulation are all possible options. And if you have something that falls outside of that scope, you're certainly more than welcome to do it. For example, people have created their own ACEs over the past couple of years, including one in social emergency medicine and also one in journalism and emergency medicine.
For flexibility, we are so lucky that we have a program director who is so supportive and like wants us to do whatever our kind of minds can come up with. We've had residents go to South Africa. We've had residents go and teach ultrasound in Mexico. We have residents doing talks all over the continent, and really, if you can think of it and you can justify it, you can do it. And it's really exciting to use the time in residency to kind of explore various things.
There are a few things that makes the Vancouver residency program super special. The first thing is the residents and how close-knit they are and how amazing they are, how involved they are. A lot of the program got developed because of the feedback from the residents and what they value, what they wanted to do, what they wanted to see in the program. So the program has specifically been developed for the residents, kind of by the residents, which is great.
We get to know each other throughout the various years, and we really do a lot of things together. An example of that is that we have bonding days every couple of months, where instead of having any academic stuff on our academic days, we just do activities together, whether that be like bowling or going for a hike or going kayaking or going on a brewery tour.
Coming from out of province, I feel like the transition was made a lot better by how welcoming the department was. All the upper year residents really went out of their way to organize events for us in the first few months, and we had lots of time to bond with our cohort as well. I think that staff in the department really went out of their way to introduce themselves and welcome us.
And I think that you also have like all these opportunities to create like strong bonds with your residents. Our emergency community here is just so strong, and we have like a lot of hangouts outside of the shift. You almost get like this huge family like that's spread across BC, which is amazing.
Vancouver is a great place to live for residency. You'll always be surrounded by stunning mountain and ocean views. It's so fun to go skiing at Whistler on your days off or go for a quick swim at Kits Beach after your shift. The restaurant scene is amazing, and there's always a co-resident up for adventure.
Good luck with CaRMS. We're super excited that you've been able to interview with us, and hopefully we'll be able to see you in July.